What I'm going to do today. Probably most of you will remember the early 1970s and Henry Morgentaler. He was a family doctor, actually, who began to do abortions, and at that time they were illegal. So he was doing illegal abortions, but he really began a movement to have abortion legalized in Canada. He personally did, come on up, he personally did 5,000 abortions himself. So here we go. Oh, you get to sit right in the middle. There you go. So let me just move back.
Oh, lucky you.
We just fit everybody in. It's home. So abortion is technically defined as termination of pregnancy up until 20 weeks of gestation. Okay, so 20 weeks, that's halfway. So that's the legal definition unilaterally across different countries. Within Canada, though, we do not have a law. We don't have an abortion law. So if anyone wants an abortion in Canada, a woman can have an abortion right up to partial birth abortion, full birth, till the time the baby is in the birth canal. So that is that's legal in Canada because nothing about abortion is illegal in Canada. So I have a problem with that. I know that many people have a problem with that. I'm very pro-life, partly because of my history, and some of you may know this, and the rest of you are about to hear it, but my mom was raped and I was conceived as a result of that rape. So I'm very much pro-life because she was offered abortion in 1955. She was offered abortion, and she chose not to. And I'll tell you, in 1955, for a young woman to be pregnant was not like it is now. Now, if a young woman is pregnant and not married, that's not such a big concern, but then it was. So she had to move to Toronto and stayed there until after I was born. I was put in a foster home. It's a long story. Anyways, so let me go back to describing some of the things that you may or may not know. The baby in the womb is not called an infant or a baby. It's called an embryo or a fetus. So let me explain what both of those are. An embryo refers to the human developing form from the 2nd week to the 8th week of the pregnancy. So that's an embryo up to the 8th week. And often, it's often referred to as a bunch of cells, a zygote as well. Various names are given. Baby is not one of them. It used to be called a baby. And in fact, if a mom is wanting to carry this child, very often, and most often, they will call it a baby. It's their baby, right? As soon as they know they're pregnant, they want to think about it as a baby. But it's not considered a human baby. It's called an embryo. A fetus then refers to the developing human from approximately 40 days or 60 days of gestation up until the birth. So it doesn't actually become a human baby until it breathes its first breath. So already you can tell the language has been changed in the last 50 years, right? The language of what a pregnancy, what a baby in the womb actually is. And so that helps people separate themselves from this actually being a human infant in the womb. So let me talk about statistics. I took these from Abortion Rights Coalition 2019. I have some stats from that coalition. I have some from Canada Statistics. So 2017, there were 94,030 abortions in Canada. That was down from prior years. The highest year of most abortions was 2011, and there were 108,080 108,844 abortions. So approximately 20% of all Canadian pregnancies end in abortion. 20% of pregnancies end in abortion. That's very high. 2.4% of those pregnancies or abortions were performed on women aged 17 or younger. So a very small percentage is actually for teenagers. Most of them are older. 54.5% are women aged 18 to 29, and another 43% are performed on women over 30 years of age. So it's not typically it's not the young people who are having these abortions, and that's something that is counter what you would hear on the media, because what is often talked about is these young people need to have access to abortion, and that teens need to have all of this, and so we get the perspective that there's a huge majority of teen girls that actually have abortions, and that's not the truth. So women over 18, that's the 18 to over 30, I guess, and probably older than that, of course. So the gestational age, so hospitals, this is from hospitals, they are required to keep record of the gestational age of the infant that's being aborted. Clinics are not required to do that. The vast majority of abortions are done in clinics, abortion clinics. About 68% of abortions happen in clinics. So this is statistics about the gestational age in hospitals only, except Quebec. And I don't understand why, maybe they aren't required to keep the statistics in Quebec, or they're not required to divulge them. I'm not sure. But this is 2017. So infants 8 weeks or less, there were 6,724 aborted in 2017. 9 to 12 weeks, there were 7,861. 13 to 16 weeks, there were 1,653 abortions at that age. 17 to 20 weeks, there were 906. So 20 weeks is getting up to the halfway mark. This 23 weeks, babies can be viable and live outside the womb, right? It's not easy, but we have prenatal ability to take care of these babies. So yes, there's a chair over here. So only the hospital report the abortion number by these limits. 20 weeks plus, so that's 21 weeks plus, there were 706 babies aborted after the 21-week mark. They would all be categorized partial birth abortions, and I'll talk a little bit more about that. So there were a total also of 10,335 estimated abortions done after 12 weeks gestation. So let me break this down. At the 8-week mark, your baby, the fetus, looks like a human. Like doesn't look like a clump of cells. It's beginning to look like a human. It's identifiable as a baby. At the 12-week mark, it's about 2 inches long. That doesn't seem very long, but perfectly formed, and pretty much has all his or her important organs developed. Now the main job is just basically growing, so they just keep growing. So that's by 12 weeks. So let's talk a little bit then. I'm going to talk a little bit about the process, the procedures of these abortions. An induced abortion. So I'm going to talk about different techniques of abortion. So an induced abortion, and everybody can hear me okay? Good. wind chimes and breeze. Beautiful.
It's just like background music.
It's perfect. So induced abortion is the active removal of the human fetus, the baby, from the uterus before the stage of viability, or 20 weeks. So an induction abortion is before 20 weeks gestation, anything before that. But there's different things, different ways of aborting a child. So, and I'll talk about that. It depends on the stage of pregnancy and the size of the developing infant. So the abortionist will decide what type of abortion to do depending on how long this gestation has been and the size of the infant. So clinic abortion methods are only recorded for the province of Alberta. So like I said, the methods and the gestational time are recorded for hospitals, their requirement, but only in Alberta are the methods of clinics actually disclosed. So we don't have a way of tracking how clinics across the rest of Canada actually perform the abortions. So medical abortion methods. So there's induction, and I'll talk about that in a little more detail in a minute. But medical abortion methods, those are abortions that use a combination of drugs, and they work together to bring about the abortion over a period of days or weeks. So the mother ingests drugs or given drugs, and that will kind of spontaneously abort the baby, but it takes days or weeks. It's effective over 90% of the time, up to 9 weeks of pregnancy. So after 9 weeks, this is not the way to go to abort this baby. Medical abortion is considered successful if the complete expulsion of the baby, of the embryo, it's called, and the placenta occurs without the need for surgery. But often that's not the case. So if there's a need for surgery, then the mom has to go back in, and sometimes the baby will abort, but the placenta won't. So won't come out. So it's not commonly recommended, though, for pregnancies past the first 49 days. When severe bleeding is present, surgical techniques are used to complete the abortion. So even though a woman may think that she can just take some medication and it'll all be over, that's not always the case. And I don't have the stats for how often that doesn't work well. Although it said it's effective in over 90%, so I don't know if that's including, total effectiveness or partially effective. Medical abortion has a 10-fold greater risk of serious infection and death than surgical or suction curettage abortion, and I'll explain those as well. So remember, 8 weeks or less, so that's the method. Medical abortion would be used for aborting the baby at 8 weeks or less. There were 6,724 babies aborted in Canada in 2017 at 8 weeks or less. Now, surgical abortions, of course, will be done using surgical instruments, and the procedures vary, again, due to the stage of development of the pregnancy and the size of the fetus. Again, everything is dependent on what's going on. So in 2016, abortions performed in Canadian hospitals, of those abortions, about 94% were surgically performed. 94%. So there's a bit of overlap here, so I think some of the medical abortion methods perhaps didn't work, and so some of those are included in the 94%. Suction aspiration, which comes under the surgical abortion method, basically means that it's a vacuum abortion, and I know this is quite detailed, so I'm hoping it's okay with your kids, Ryan. Very good, yeah. Anyways, so it's suction, dilation, and cutterage. And cutterage is actually cutting the infant out of the womb. So suction tears the infant into pieces, into small parts, and is sucked in a tube, and then into a collection bottle, and then a sharp loop-shaped knife is inserted into the uterus to loosen any remaining tissue so that it can be suctioned out. When that is all completed, the abortionist must examine everything that's been suctioned and brought out to make sure that the abortion is complete. Because if it isn't, then there's all kinds of complications that can happen to a woman. Just like when you have a natural birth, if everything doesn't come out, there can be complications, right?
You get sepsis.
So this is very much the way it is with abortion as well. So the suction cutterage abortion is done under general anesthetic and usually done in a clinic, and sometimes a local anesthetic can be used. Again, it depends on the size of the baby.
Sorry.
Yeah, no, that's good. So here's another. This is called dilation and evacuation. So there's so many different kinds, right? But it still comes under the surgical abortion method. So it's a dilation of the cervix using medication, using drugs. And this is for an infant who is in the second trimester. So 13 to 24 weeks, this baby is 13 to 24 weeks, means that this baby, if it's after the 21st to, well, let's say the 23rd week, this baby could live outside the womb. So 11% of abortions in Canada actually occur after the 13-week mark. And remember, if, I was telling you that at 12 weeks, the baby is absolutely, has all its organs. All it has to do is grow. I mean, it just looks like a baby. And we have fabulous pictures now that we can do by scoping and all the other things that are available. So 11% of abortions occur after 13-week gestation. Sometimes medications such as potassium chloride are injected into the fetus through the woman's abdomen to kill it before the dilation and evacuation procedure. Sometimes. Now, Dr. Levinetto, has anyone actually seen a short, I think it's about a 4-minute video that he did. He did it before the U.S. Congress, and I have the YouTube, the URL. So if you want to watch that video, ask me about that. And it is, it's very difficult to watch. It's not an easy thing to watch. He had performed about 1,800 abortions and fine doing that until his wife got pregnant. And after they had their first child, he went back into the clinic to continue performing abortions, and he did the first one and he never did another one. There's something about having your own child that changes everything. And so that really changed everything for him. And so he actually presented to the Congress about the process. And so he talks about exactly how a baby is surgically aborted during the dilation and evacuation method. It's called dilation and extraction. All these things are so overlapping, but the extraction method removes the intact fetus from the uterus. So while the evacuation actually, so here, pulls the parts of the baby apart, because they take legs and arms and everything off first and then pull the rest of it out. The extraction method removes an intact fetus from the womb. It's called partial birth. During the 16th week of development, a fetus will be starting to form its facial expressions, and the nervous system is growing. So these abortions are for older fetus. At 20 weeks, this baby weighs about 10 ounces, measures about 6.5 inches, and in Canada, we can abort them. We can abort them. There's another method called surgical dilation and cutterage, and so I touched on it a little bit. So the cervix is dilated, and then the knife again is used, and it cuts the fetus and the placenta from the uterine wall and breaks it all up so that it can be pulled out. Saline abortions, you may have heard about them. They're very rare now, but after 19 to 20 weeks, they are sometimes used, and a solution of saline is injected into the amniotic sac, and it actually, so it's injected before the abortion, and it kills the fetus. Now, I don't know if you've watched any videos on this, but there are several living adults who have survived this type of abortion. They've also been speaking up and speaking out about this, and so that's a whole other side of the story when someone actually survives an abortion, and it's pretty amazing to listen to them talk, and most of them are so incredibly forgiving. I mean, I'm just so overwhelmed with the sense that they're able to forgive their mom, who you know, whatever the circumstances were, and some of them are disfigured, some aren't. So they're rarely used in Canada anymore due to high maternal death and a high level of side effects, and the possibility that this baby actually could live through it. So after the first 20 weeks of pregnancy, Luminera treatment over several days is used to precipitate the abortion and to help with cervical dilation. And then the abortionist, guided by an ultrasound, uses forceps to grasp the fetus and position it face down and feet first. One of the things that is happening right now, and most of you are aware, is there's a movie that is coming to Canada after much debate, and Canadian cinemas tried to keep it out. Actually, pro-choice people tried to keep it out of Canada. It's actually rated 18 and over. But it's coming. And this is the kind of abortion that this abortion clinic director was in charge of doing and had done, and what changed her life, actually. So because they were able to watch the ultrasound and watch the baby's response and reaction when the forceps grasped the infant. And so this is called also a live birth abortion. The life of the fetus is terminated after having been extracted from the mother's body to the point past the navel of the fetus. Okay, so they turn the baby so it's not head first, right? So it doesn't get a first breath, even though it's fully developed. And so it's feet first, and so then they kill it when it's out far enough to see its navel. And if it comes head first, this is difficult, the entire fetal head is outside of the body of the mother. And then it's injected just below in the brainstem. Puncturing the base of the skull, the brain is literally suctioned out. This is stats, folks. I'm not making this up. I'll send you all the references for this. So the brain is suctioned out, the skull collapses, and the dead fetus is then finally delivered. Sometimes potassium chloride that I was talking, the saline abortion, is still used to kill the infants before delivery. There's one more step. Well, there's two more stages, actually. There's labor induction methods, which cause the uterus to contract and expel the infant. Well, here's what it said in the research. The uterus contracts and expels the pregnancy. Do you hear what language we're using? In order to make this palatable for people, and that's honestly what's happening, we don't want to call this a baby that's being delivered. We're expelling a pregnancy. So this is a reminder, 20-week-old infants, in 2017 there were 706 of them over 21 weeks that were aborted. There's also a it's called hysterectomy and hysterectomy, which refers to a cesarean delivery type of abortion. So the woman is given a cesarean section and the baby is literally lifted out. I have no idea why, and it really didn't go into why that would ever be needed. But it is an abortion method, so it's not that this baby is live and viable. I'm sorry, the baby is live and viable. It's called an abortion method. And if no chemical is injected to kill the fetus is still alive. So it's only used in very rare situations where less invasive procedures have failed. Do you hear this? Other procedures have failed, and so this is what kind of a last step, or are medically inadvisable, and there were no stats available on this type of medical abortion.